I'm Lawrence Ferrara. I am a chiropractor and now law student. I want to talk to you about a technique that you can use. You're doing it right now, but maybe not as efficiently as you can. And that is using the power of the breath to decrease stress and to change the energy and the balance of your body. How should we breathe? What is the normal, natural way human beings are designed to breathe? We're talking about the majority of people, and I'm sure it's not applicable to every single person. But as I've talked to my patients for years, I'd like to ask you the question, how should you breathe, nose or mouth? You only have two choices, right? And before you answer the question, I want you to think about what is inside your nose. Now think about some anatomy, physiology, very basic, but okay, hairs, right? And what else do you have inside your nose? Think about this for a minute. Mucus, exactly. We have mucus in the nose. And now the question is mucus a good thing or a bad thing? We're not talking about mucus overproduction when you have a cold and you can't breathe. We're talking about just mucus in general. And if you think about this for a minute, in the mucus, it's a protective mechanism actually. It's a mucus blanket that coats your nose and your throat and your lungs, and it just goes in your body to sweep away all the toxins. In the mucus is IgA, which is an antibody that fights infections, bacteria, and yes, even viruses. So we want the nose to be moist inside. That's where I'm going with this. And how are we going to do that? Think about your breath now, right? You have a choice to exhale the breath through the nose or your mouth. And what is the exhale? The carbon monoxide, right? We want to get out of our body. But what does it also contain? If you do that to a mirror, what do you see? Condensation, vapor, wetness. Your breath is designed to exhale through your nose to keep the nose nice and moist inside so it's not vulnerable to infection and pollen and allergies and all kinds of things. Under normal circumstances, you were designed to exhale through your nose. In the wintertime, right, we're more susceptible to colds and viruses. But according to the Mayo Clinic, viruses are around throughout the year. So why is it during the wintertime we're more susceptible? Because the nose is more dry. The external environment is drier. It dries out our nose. And that is why people buy humidifiers. But I'm telling you that you have a natural humidifier inside your body called that exhale. That warm, moist air exiting your lungs that should go out through your nose to decrease your need for a humidifier, because Mother Nature gives you your own humidifier. Don't waste that exhale. What about the inhale? How should you, most people at least, and of course I've not done the exam or physical on you, so I'm not sure your unique circumstances, so I'm not giving medical advice, but I want to let you know what I've told the vast majority of my patients and seen extremely wonderful results, and sometimes they're instantaneous. How should you take that inhale? Think about the anatomy again. What do we have in our nose? We said hairs, right? The mucus. Vascularity. If you ever get punched in the nose or hit your nose, or even not even, just sometimes the nose spontaneously bleeds. There's a lot of red blood cells in these. They're not even the vessels like veins. They're very thin walled and they're like tissue paper. So why would Mother Nature put all those millions of red blood cells concentrated in your nose? And it must be for a reason. It's to capture the oxygen as it goes in, because don't forget the red blood cell carries oxygen throughout your body. You were designed to breathe. If you look at the apparatus of your nose and the function and the physiology, you were designed to breathe in and out through your nose. Think about this for a minute. Now, if you breathe through your mouth, you certainly get oxygen into your lungs, and it gets distributed throughout your body. But you're bypassing a whole apparatus in your nose that's designed to capture that nourishing oxygen. And what is the most oxygen-sensitive structure of the body? The brain. That's why people faint, right? Because the brain is so desperate for oxygen, it faints, and gravity will pull the blood to the brain. That's why they tell you to lift up your feet or legs if you feel faint. or if other person's feeling faint, you lift their legs to gather that oxygen to the brain. Incidentally, and I've had patients do this, by the way, when you're on a plane, sometimes you might not feel like you can think because the altitude in the plane, and they monitor the oxygen, by the way, and if you feel dizzy and if you feel like you can't concentrate, because again, the brain, right, the functioning center where we have concentration and thinking and higher levels of thinking, what you need to do on a law school exam, by the way, it needs oxygen, but on the plane you can actually tell them to turn up the oxygen if you feel like you're having confusion or dizziness or anything like that. My point is the brain is very oxygen sensitive. Mother Nature put that oxygen capturing apparatus in your nose to take the oxygen in through your nose, not your mouth. I know there's some dispute about that. And I'm sure there may be certain circumstances where people probably need to breathe through the mouth. But under normal circumstances, the vast majority of people can benefit by taking that breath through your nose, in and out through your nose. Also, the two small nostrils of your nose, much smaller than the mouth, larger opening, you have to actually take that air in through a muscle to draw that air in. Those muscles of respiration will get weak if you only breathe through your mouth. There are many other reasons why you should breathe through your nose. That's just the tip of the iceberg. Again, we don't want the mucus to dry out, so you have to exhale out through your nose as well. My question to you is this, and I'm going to have it like a vivid example so you remember these things that I'm talking about. Why do people wake up sometimes with morning breath, right? Bad breath in the morning. Why is that? Because sometimes during the night, people maybe breathe through their mouth, maybe they have sleep apnea or some other reasons, maybe they are on medication or maybe they've had alcohol intake, can dry out the inside of your mouth as well. Those are the germs that proliferate, the normal germs that we all have, by the way, because the body is quite amazing, it has all normal flora, and it's a completely different subject, but it's very interesting. But those are the normal germs that we have that proliferate when we don't have the mucus to control the balance of the bacteria. So they proliferate, they cause the bad breath, and that's the reason why. So we know that mucus is very important. Now, another question, let's get more vivid about this. Why do dead bodies smell, right? Decay. Because, again, you guessed it, since we're on this topic of mucus, the mucus dries out, and over time, it doesn't just get like waking up in the morning with morning breath, it's far beyond that, and it starts to actually, the bacteria decomposes the body. What about the eyes? Right? There's mucus in your eyes called tears. That's there for a reason. If you didn't blink for a long duration, your eyes would get red. And if you didn't blink for many more hours, it would start to actually decompose. Mucus is a good thing. We don't want mucus to dry out. And the way to do that, at least in your nose, is to exhale through your nose. Inhale because your brain, as well as the rest of the body, needs oxygen. And you're depriving that whole apparatus in your nose, the blood supply, you're depriving it of the much needed oxygen in your body. So we talked about inhale, we talked about exhale, now we're going to talk about balanced breathing. What is that? For instance, your whole body works on sympathetic nervous system and the parasympathetic nervous system. You can think of the sympathetic nervous system as tightening and the parasympathetic relaxing. Okay? So let's demonstrate this by looking at your heart. There are two wires, and I call them wires. They're really nerves, but they do conduct electricity, so think of them as like wires conducting your heart. The sympathetic nervous system controls your heart, like every part of your body and mind, and the parasympathetic controls your heart to slow it down. One speeds it up, one slows it down. We need balance, and balance is the whole key word here. So that's wonderful. Now I have a professor in chiropractic college who said that what she did, she put a suppository in the anal region, right? And it actually caused heart failure in a patient, okay? Because what she did was she actually stimulated the parasympathetic nervous system, which is in the anal region. My point in saying this is that you need to balance sympathetic nervous system, which is like the yin-yang in ancient Asian healing, and Ayurvedic as well, they've talked about this, and also the parasympathetic that relaxes. Think about this. If you eat Talk about that for a minute. Because we said the parasympathetic and the sympathetic has to be in balance for the body to be in balance. And your breathing can actually change this. That's why we're talking about this. But think about this for a minute. When you eat, how does that food go through your whole body? How does it move through your whole body? And it's a system called peristalsis. Your body, your intestines contract, sympathetic nervous system, relax, parasympathetic, sympathetic, parasympathetic, and it keeps doing that, and that's how the food moves throughout your body. When that fine balance is disrupted, we have constipation, diarrhea, irritable bowel syndrome, all kinds, malabsorption syndromes, all kinds of problems. My point is we want to make sure the sympathetic, parasympathetic nervous system are in balance. The yin, the yang, the male masculine side of ourselves versus the female, if you want to be gendered about it. But you want to make sure they're in balance. And here's a way, according to Ayurvedic medicine, and this has been around for thousands of years, this is nothing new, medical science, in the Western medical science, sometimes forgets this. But you can control the sympathetic, parasympathetic, and thereby relax your body and decrease stress, as well as have your whole body function correctly and with ease by breathing. My question to you is, now, think about this. Your breathing is controlled by what? Sympathetic? That's that system that speeds everything up, tightens things. Or parasympathetic? Well, I think half of you are right and half of you are wrong. And not all of you are probably half right. My point is, it's both. If you think about it, we said the sympathetic is strengthening and muscle action and energy. And when you take that air into the two small nostrils, you have to suck it in with a muscle, right? You need a muscle to contract to do that. And if you don't breathe it in and you're only breathing through your mouth, you use less muscle involvement and therefore those muscles get weak. My point is, that's a sympathetic nervous system, muscle contraction. And when you let out the breath, right, it's exhale and it's relaxing, that's the parasympathetic. If you balance your breathing, you can balance the sympathetic and the parasympathetic nervous system that controls the whole body. Digestion, the heart, which you talked about, intimate moments, for instance, and stress and tension when you're in traffic or have to ask that boss for a raise, or you have to take that test. I've had a professor tell me that he noticed when students were taking exams, right, we tend to hold our breath. We hold the breath when we're tense and we're tight. And that's when your brain needs it the most, so you don't want to hold your breath. Try to do this. Try to use an elastic and put it on your wrist for the next 3 weeks, because that's how long it takes to institute a new habit. And every time, this will be, or put a sticky note on your computer, and every time you catch yourself, it's like posture. Every time you catch yourself, just correct it. Over the course of, you're not going to be good at it and perfect at it in the first week or two. But after the course of time, you will get better and better at it. Of course, unless you have some reason why you can't, such as polyps or deviated septum or other reasons. But for the vast majority of people, this can benefit you miraculously. I've seen it. Also, I want to talk about energy, because the breath is like energy. You ever see a battery that has negative and positive? You know, in the old days we used to put our tongue out to see if it was, if there's juice in it, had energy. If a battery is full of energy, right? There's negative and positive. Well, I'm talking about the negative and positive of the body, the sympathetic, parasympathetic, that is energy. It will give you more energy to breathe in and out through your nose. It can help you lose weight or gain weight or change your metabolism. I've seen this so many times, and especially because right now I, breathing through my nose. But what if you exercise and, you're increasing your heart rate and your respiration, and then it's even more pronounced when you do that because your heart is beating and you get more circulation of that blood supply. And the blood supply, we said, carries oxygen. Let's talk about another kind of esoteric thing, but I want to bring it to your attention because I want you to notice and be perceptive that when you change your breathing, and breathing is energy, you'll notice that other people in the room that you're talking to, or the intimate moment with your partner, can change their energy too. It's almost like when you have body posture, and I've seen this a million times, Whether if someone comes in and they're sitting there like this, or you have other people in the room, or you're talking to anyone about anything really, change your posture. You will see they will change it too. There's a response. Same thing is true with your breathing. If you breathe, because your breathing kind of adapts to the room, so if everyone's having maybe a heated discussion, or if it's a job interview, or just even a happy, excited time, everyone breathes a certain way. And if you change your breathing, right, in through your nose, in a balanced way, out in a balanced way, balances the sympathetic, parasympathetic nervous system, you will notice that you will begin to change other people's breathing and energy as well. I want you to notice that. I want you to get really good at perceiving that. Also, think about this. Breathing is a state of consciousness. What do I mean by that, right? That sounds really esoteric, but not really. Because if you are maybe scared of heights and you're on a high bridge, how are you breathing? If you are with your date, how are you breathing? If you have to ask someone for a date, ask that boss for a raise. Driving in traffic, how are you breathing? How are you breathing when you're just relaxing, watching a film? My point is, your breathing is it reflects a state of mind. So if you can change your breathing, you can change your state of mind, including stress and anxiety. No drugs, doesn't cost any time, and it doesn't cost any money. What could be better than that? It just takes, however, a little bit of discipline, and that's why we have the elastic on your wrist to remind you every once in a while to just change the habit and begin to breathe in and out in a balanced way through your nose. I recommend, for most people, and I'm not sure about you because I haven't done the physical examination on you, but for most people, and I'm going to kind of conduct my breathing so you can see it in the video, but it's not really what you do in normal life. I'm going to conduct my breath so you can see. And you go in, you hold it maybe for a second or two, and then you go elongate that exhale and go not just out, all the way out. Every last drop of oxygen, which is really carbon monoxide, because you don't want pollutants in your body. Now, when you relax doing the breathing that I just showed you, once in a while you can take, throughout the day in class or wherever you are, you can take that nice meditative breath, but sometimes you could spend actually 10 or 15, 20 minutes breathing like that, which is like breathing meditation. Now, breathing can relax people. That's a scary thought for some people, because when they relax, all the emotions come out. Things you don't want to think about. Stress from yesterday, or even stress from childhood. And people have events in childhood that cause them stress. And what do when people are under stress? They hold their breath and they tighten the muscles. And they bring that pattern with them their whole life. Think about that. We just talked about breathing and how it can alter and make people stressed. And when you change the breathing, it can relax you. And I recommend that when you take the breath in and take the breath out, for most people it's very relaxing. But for some people, some of these emotions come out, the thoughts come out. Let them come out. Don't attach any weight to them and just let them dissipate, Ever see like a dragon with kind of a puff of gray air, around his nose, like, he's huffing and puffing? Think about that. Visualize it as taking that negativity and this toxicity and carbon monoxide as well, and negative thoughts and emotions or whatever you have, and just think about when you go in and you go out, that you're bringing those negative emotions out of your body so they don't cause dis-ease. You want them to emerge. You don't want to suppress thoughts. And I think a lot of people kind of like they have to be busy. They don't want to relax because they don't want to confront some of these thoughts and feelings. I recommend people breathe, relax, let them come out. And if they emerge and create emergency, then then you can talk to someone about that and maybe get some help. That's the perfect reason why people should, whether your neighbor or any professional, just get it out of the body where it doesn't create such toxicity. So I'm going to end with a nice breath, a nice relaxing breath, and I hope that you will find this very useful. And again, this is not really medical advice for you because I'm not sure who you are. I haven't done a physical exam, but I'm happy to offer you and share with you what I found so useful And this is just the tip of the iceberg, what I told you today. So useful for so many people that I want to end with a very relaxing breath. Okay, I'm going to conduct it with my hand, but of course you don't do this in real life. I'm holding it for a couple seconds, and then slowly you let it out all the way, and I feel so relaxed right now. Thank you for joining me, and I hope you learned something from this video.